Okay. Does your child suffer from that itchy rash called eczema? Up to 20% of children do. I'm Dr. Jason, and I'm here to talk about some practical tips to control eczema and keep your child's skin healthy. Eczema, also called atopic dermatitis, causes dry, itchy, and inflamed skin. It's often associated with allergies or skin sensitivities. Often we can't find a trigger, but it is worth looking for one. Let's dive into some essential skincare tips for children with eczema. My first tip is to keep the skin moisturized. Moisturizers are important in managing eczema by keeping the skin hydrated and preventing flare-ups. Use them at least twice a day. Remember to reapply after bathing or washing or whenever the skin feels dry. I like moisturizing creams better than lotions. They typically come in a tub rather than a bottle. Avoid anything that smells nice or has a pretty color. Those dyes and perfumes are common triggers of eczema. You should use an allergy or baby laundry detergent to wash your baby's clothes and really everybody in the family. My next tip is to be gentle when cleansing. Use a mild, fragrance-free cleanser or soap substitutes when bathing your child. Avoid hot water as it can dry out the skin further. Instead, use lukewarm water and limit bath time to about 10 minutes. Use soap substitutes or skin cleansers instead of soaps, which can leave a residue and be drying to the skin. Gently pat the skin afterwards with a soft towel. Rubbing the skin can make eczema worse. Then put on a good thick layer of moisturizing cream right after that. Tip number 3 is to choose cotton clothing. Cotton is a breathable fabric that keeps the skin cool and prevents irritation. Avoid rough or scratchy materials like wool, because they can worsen eczema symptoms. Remember to wash new clothes before your child wears them to remove any irritants or chemicals. Tip number 4 is to maintain a consistent temperature. Extreme heat or extreme cold can trigger eczema flare-ups. And use a humidifier during dry months to add moisture to the air. Also, make sure your child is dressed appropriately for the weather. The next tip is simply to avoid triggers. Try to find them and try to stay away from them. Eczema triggers can vary a lot. Some common ones include certain foods, allergens, and irritants like soap or laundry detergents, particularly anything that makes those soaps or laundry detergents have a pretty color or smell nice. Pay attention to what worsens your child's eczema and try to minimize exposure to these triggers. Your child's healthcare provider may prescribe steroid creams or ointments that will decrease inflammation, but these can only be used for short periods of time mostly, so follow the instructions carefully. There are other prescription options available, and other medications may be needed if the skin gets infected. So see your child's healthcare provider. Special interventions like diluted bleach baths and wet-dry wraps might also help your child. I won't go into details of those here, but do ask your child's healthcare provider about them. My last tip is to consult a dermatologist or an allergist who has specialty in eczema. If your child's eczema symptoms persist despite your best efforts and your healthcare providers, your provider might refer you to a specialist. A dermatologist can provide personalized advice, prescribe medicines if necessary, and guide you through additional treatment or diagnosis options. Remember, with proper care and guidance, we can effectively manage eczema and help your child to have healthier skin. Thanks for joining me today. If you have any questions or concerns, don't hesitate to reach out to your pediatrician or dermatologist. Take care and be well.